And now it's my pleasure to announce the next talk. Dr. Dianna Wheaton is talking about the FTD Disorder Registry, which is actually a registry that is directed to you, even though it doesn't say the word PSP or CBD in the title. But that's really important, and I think Dianna will explain exactly what the registry is about. Thank you.
Thank you so much for the opportunity to talk about the registry today. The FTD Disorders Registry was created literally as a secure online database designed specifically to be the home of all individuals who want to participate in FTD research. We literally want to create a community where you can share your unique experience with FTD to help us understand these diseases better and to support the development of new treatments. The registry was established as a fully independent entity with the Patient Caregiver Registry as its sole nonprofit mission, and it was founded March 2015 by two nonprofit organizations, the Association for Frontal Temporal Dementia and the Bluefield Project for the Cure, and it's supported by funds from the two founding organizations as well as a grant from the Rainwater Charitable Tau Consortium. The registry itself is both a contact and a research registry. As a contact registry, it has international scope, and participants in the contact registry have access to informational updates and e-newsletters. The research registry is geographically bounded, and it's restricted to the United States and Canada. And it's really focused to do health outcome research and to support clinical trial and research study recruitment. If you enroll in the research registry, you create a password-protected account and you're assigned a special coded identifier to protect your identity. The data collection tool for the research registry is the use of surveys and questionnaires that are administered online. And the FTD Disorders Registry created 3 intake surveys that actually form the basis or the foundation of the registry data. And those cover demographics, disease impact, and research readiness. We will also be administering client partner surveys, and our first client partner is the Artful Clinical Network, which is sharing with us surveys that they use at their clinical sites. And these are the lifestyle questionnaire, autoimmune history, and clinical trials. Additional surveys will be added to the registry as we move forward. So the question you may ask yourself is, why join? Is there something in it for me? Is there some benefit to others? Is there a benefit to science? And the answer is yes, absolutely. Your experience can improve our knowledge of FTD. It can impact care, and it can help others. Participating in the research surveys will provide data to advance the science, and the registry will become the go-to site to recruit for FTD clinical trials. So the next question is, who can join? Persons impacted by any of the FTD disorders. This is behavioral variant FTD, PPA, PSP, CBD, and FTD ALS, and all variants thereof. We are enrolling persons diagnosed, self-enrolling, or with the help of a caregiver, biological family members, as well as spouse, caregiver friends. The registry launched March of 2017, so we've only been up and enrolling for about 7 months now. You'll notice that there's a number at the top of that slide that says 1,059. So in that 7-month period, we've already enrolled 1,059 individuals. 90% are within the United States. This shows you a scatter plot of where those individuals live. And the greatest enrolling international sites are Canada, Australia, and the UK. We can also look at those enrollees, and you can see that the largest piece of the pie belongs to spouse, caregiver, friends, followed by the biological family members, and then the FTD diagnosed persons. Participation type, contact registry versus research registry, is split straight down the middle, 50-50 split. So what can we do with the data? Obviously, we can tabulate who, where, and how many, but it really goes beyond basic demographic characteristics. We want to build a clearer picture of the impact of FTD from the patient, caregiver, and family perspective. We want to assess research study and clinical trial feasibility. We want to use the data to raise awareness and advance research, facilitate advocacy, and we want to remind you the big take-home message is your participation has the power to make a difference. So please consider joining the FTD registry. Tell your story. Thank you.